Hello. I wanted to give you all an update and also talk about another health concern with Ehlers-Danlos Syndrome, which is the connective tissue disorder that I have. And this is a recent update. Thought some of you might find it interesting. So, EDS is progressive in ways that we can't really foresee. The effects that it has on the body seem to come quickly and out of nowhere, which is what we've kind of been dealing with for the past 2 years. My overall health has just kind of gone downhill very quickly, and not because of anything that I'm doing wrong or something that I'm not doing. It just happens, and it seems like every week it's something different. And since May, it's actually been my teeth. My teeth have just started breaking and crumbling. It's not necessarily because there's a cavity in there. One of them didn't have a cavity at all. I just wake up and I'll find large chunks of my tooth floating around in my mouth. It's really freaky, it's really scary, it's painful. Unfortunately, things like Novocaine and lidocaine aren't always effective for people with EDS, so it's very, very difficult to numb our mouths. So dental work is difficult for us in general. On the EDS organization website, there's actually pamphlets that you can print out and take to your dentist because we have such special needs in that area. Anyway, I had several teeth pulled back at the beginning of summer because they literally just broke off. 2 did in the same day. 2 weeks ago, one of my molars broke in half, and I lived with it for about a week thinking it wasn't really painful. Unfortunately, it did get an abscess though, which meant I had to have something done to it, and I went to the dentist, and they didn't feel comfortable pulling it, the way they would most people's because of the extenuating circumstances. So they sent me to an oral surgeon. Now this was one tooth, what should have been a simple extraction, but there's all kinds of complications with it, which most people don't have. I ended up with dry socket, so I still have the dry socket, but it was this back molar, the bottom molar here. Within 3 days, this whole side of my face had swollen, and this side of my neck. My eye, I could barely open it and close it. It was the pain around here was so bad. And it's kind of typical, pulling a top molar. A lot of times you'll end up with sinus issues, but this was a bottom one. It shouldn't have done that. So not only did I have, like sinus type pain around here that eventually turned into a migraine. So then there was a lot of vomiting and head pain. My throat was swollen. I couldn't even eat the soft foods that I was allowed to eat because it hurt to swallow. It's still swollen, the lymph nodes are swollen, but my throat is still swollen. It was hard to talk. My mouth continued to bleed, and they didn't put stitches in because the stitches don't really hold inside my mouth, so they try not to put any in at all. So 7 days into it now, I still have, bleeding. I still have to use the packs on the area because of the blood. I've got the dry socket. I ended up having to go back to the hospital because of the complications. And for one tooth extraction, here's what I get. I get actually 3 different kinds of antibiotics. So yeah, 3 antibiotics plus a those antibacterial mouthwashes to use. I also get pain medication, which I'm at the end of for it because it was just a week supply, and steroids for the inflammation. So I did end up getting an infection post-op. I had an abscess before I went in, but I ended up with the infection afterwards too. So, I had the pre and post-op infection, and it got into my jawbone, and that's why I've got the 3, actually 4 different antibiotics. It is really painful. The worst part has been I've been completely out for a week. Like, I haven't been able to do anything. And this, my husband had tooth problems, and it was taken care of the next day. He was up walking around. Here I am more than a week later. I'm just now able to get off the couch. I do hope that in the near future, we just go ahead and remove all the teeth, and I'll probably go to dentures, because this is just going to keep happening. And this is the 5th tooth that's happened to in the past 4 months. And I don't want to have all of these individual surgeries. I'd like probably to just have them all taken out at once. It's better to recover from one big surgery than a bunch of minor ones that end up, with bad outcomes anyway. I just have to have it all done at once. I'm eating now. I'm starving. Oh my god, I'm so hungry. I want to eat everything, and I can't because of the dry socket. It's still really painful, but I just keep thinking about food. That's all I think about. Food. My god. My laptop screen here looks like one of those square pizzas you used to get in school cafeteria. If I close my eyes and I touch it, pepperoni, mozzarella. Might just be the medication talking too. I'll see you all later. Bye-bye.